you said about symptoms, and you know that to talk about the sexual reproductive health in many communities is like a taboo.
Yes.
So what an individual who have irregularity can go to the healthcare provider, what should they say? The languages, what history they can give to the doctor in order that he can give the best treatment?
Thank you for this question. When I was coming, I was actually thinking about this because there is a lot of stigma around menstrual, especially in our African countries where it's supposed to be something secretive. So what I would advise to every female is come telling us about exactly what is happening.
Yes.
There is no other language to formulate. You say, doctor, there is a way. No, come and tell me I'm not getting my menses.
You know, in primary school, normally you go to the menses and you said, teacher, I have a headache. And I'm wondering, a headache every month, headache. So they go and tell the truth.
Yeah, there is no other language to pass, around the bush.
Okay.
Just come, tell me, because I'm a doctor. Of course, doctors diagnose, they know what is happening. You may have symptoms and you don't know what's happening, but when a doctor hears you, they formulate and know what's wrong. So
Okay.
I have been going around schools educating young girls and also young males because I feel like we have to educate the community at large, because if I'm a female and I talk about periods and a man looks at me like you're not supposed to be talking about that, no, he should also be okay to listen to that, because we also have male doctors, male nurses, so there is no way to go around the bush talking about menstruation. Menstruation is natural. Menstruation is supposed to be talked about as it is, because that's how we are and we are not going to change it. So what we do is live with it and accept that it's normal, it's natural, and it should be tackled.
Can you be proud?
Yes, we are.
Because I think when you don't have that kind of menses, the other struggle begin.
Exactly, and we couldn't be having, births. So many females delay for consultation because of what would they say? First of all, they don't even tell. If it's a married woman, it's hard for them to even tell the husband, because he's going to think that I'm no longer having his babies. Or if you're a lady, you fear that what if they told me that I'm not gonna have babies? So let's not be doctors if we haven't graduated. So let's go to the doctor, get diagnosed, and get the help that we need.
That is good advice. So go to the health center, go with a lot of questions, ask questions, and also share everything you have. You are going to get a good solution of your problem. Dr. E, so is there any myth,
Yes.
misconception
Yes.
related to the irregular menses that you can tackle and how you can overcome that?
So some of the myths is that for every woman that has irregularities, that they can't have babies, that they can't get pregnant. So that's wrong, because for every ovulation, a woman can conceive and they can have a baby. So let's not think that for everyone who has irregularities, then it's not gonna be, productive later in life.
Yes.
Yeah. The other myth is that maybe they have been bewitched. This is Africa, so everything will be, everything will be like, I've been bewitched. Maybe someone came and did this. No, this is a disease like any other disease, any other disease that we have in lives. So, and it's something that can be treated and become right. So no one sent anything to you. It's okay and it's normal. It's a natural disease.
And sometimes they may think that it is normal, it will treat itself.
Oh, maybe that brings us to some of the lifestyle changes that can help in these irregularities.
Yes.
We have exercises.
Okay.
I talk that exercises may be a cause, but they also may be medication.
Okay.
So for exercises, we say that as a woman, you should do the exercises that are required by your body, not a lot, so that you do
Yes.
not tire you overtire your body. And when you have irregularities, we also recommend that you do exercises daily. And these exercises, they have to focus on the pelvis, because this is where we have to get active, we have to get the blood flow, so that they may help you with the pelvis. And the other thing that we have to do is the hip bath.
Okay.
Most of the women don't know that, but then you put a basin of water and put some lukewarm water and then sit in it just around 6 to 10 minutes before you shower.
You just sit in
a basin, you put it down. So in a position where you sit, if you sit your hip in a basin, your knees will be flexed. So you hold them like this with your hip down. This one in lukewarm water will help your vaginal muscles to relax and contract. And this is also an exercise for the pelvis. So this relaxation and contraction may help the regularity of your menses, as they also help with the hormonal balance.
Oh, interesting.
Yes.
So it means that you go and sit in the lukewarm water without any addition, anything?
No, there is no addition, just lukewarm water. And it doesn't have to be hot. Yes, and it doesn't have to be cold. Because if it's cold, then your vagina is only going to contract. But then if it is lukewarm, it will contract and relax. Yes.
So by saying other exercise, also talk about sleep.
Yes. So the exercises, we also have walking, running daily, something that will improve your blood circulation mainly, and also work out on your pelvis. And then we are talking about sleep, because sleep is the cure of stress. Sleep is the cure of a tired body. So we advise that anytime you have had these irregularities, think about sleeping enough. As we know, we say 8 hours, a third of the day. That's the optimum, good time for a sleep. So I recommend 8 hours of sleep. Try and avoid stress, which is hard, but if you had a stressful day at work, come, go for a night run maybe. Before you shower, you have that hip bath. After the hip bath, a good sleep, good mental health, good relationship with the people that are around you, then this is something that's going to correct itself. Yes.
Wow, that is good. So let's go to the treatment. Is there any medication, any treatment you offer at the hospital? But also don't forget to tell us about homemade, natural medication, if there is.
Yes.
Any nutrition someone can take. Yes.
So I will start with the homemade. The nutrition, first of all, we need some of the supplements, like calcium, we need magnesium, we need vitamins, both B and also D. So that's something we need in consideration. Some doctors have recommended ginger water, where we boil ginger in hot water and then let it cool down and then drink a glass. And also papaya. We all know papaya, especially the green papaya. Those are some things that I've researched that have helped many women to cure these irregularities. And for the medication, when you have tried all that, when we tell you that there are these all home remedies, it's first good to go seek your doctor's help. And if your doctor advises you to go and try the home remedies, then it's okay. And if they advise to do further examinations and also give medication, then that's okay. So when we come, as I said, we evaluate from the brain to the uterus and also to the ovary. So we treat the underlying conditions. Yes, so I would say the treatment is broad, but mostly they may prescribe the oral contraceptives.
Okay.
They help a lot in irregularities and also the abnormal uterine bleeding.
Yes.
But other treatments are mainly departmental according to the causes.
Okay.
Yes. Because some of the causes are also congenital actually, where some kids are born with adrenal hyperplasia maybe, and their hormones are so imbalanced from the start.
Okay.
Yes.
It means that you give treatment according to the cause.
Yes.
If it is hormonal, maybe you can give the hormonal supplement.
Yes.
Above control.
Yes.
Can those kind of regulate need this surgical operation?
Surgical operation, we've seen that maybe if we are having a lot of fibroids that are causing the irregularities, then definitely we are going to operate.
Okay.
That's it's also according to the causes, but
Yes.
some of them can lead to operation.
Yes.
But that's your doctor that's going to decide that. Yes.
Okay. So let's go to the practical. I want that you can teach someone who is watching us
Yes.
how he can, any tips, any practical thing she can use in order that she can control that kind of irregularity, if it is possible. How she can track that? To know, first of all, that is irregular,
Yes.
and also to control that, practical things.
Yeah, actually, thank you for that, because most of the ladies out here don't even know how to track. And for me as a lady, I use an app in the phone that helps me to know what time of the month that I'm in.
Okay.
It's an application that will help you log in your period time, and it will show you your fertile window, time for ovulation, and how many days it have spent. So it will record for you every month. You will see how many days you've used. And I understand not all of us use smartphones, so I would recommend a pen and paper. You can date down the dates you use maybe for your periods. Let's say if your last period was from 1st to 4th, then the next period will be, and then for 3-4 cycles you have to count and see how many days, what is the difference of the interval. So I would say that's the first way to track your periods. And then how to do any practical thing you could do that will help you. Obviously, we've talked about lifestyle change. It's always lifestyle change. In the lifestyle change, we talked about exercises, we talked about sleep, we talked about stress management, we talked about dietary changes. So those are the things that will help, and actually it does work.
It works?
It works.
Sure.
Yes.
Thank you, Dr. Lee. Let's go to the end of this talk. What are advice you can give to someone who has irregular menses, but not only to that kind of woman or a girl, but also to his closest boyfriend, a father, or a husband? What advice would you give them?
The advice that I would really give is seek medical help.
Sure.
And advise your loved ones to seek medical help, because in a country like this, in Rwanda, the medical field is to us. In our communities, we start with community health workers to the health center, hospital. These are all accessible and affordable places to be. So do not sit at home and let your wife, have all that if she's able to share. And the other thing is also give room for these women to share. She maybe try to talk to you, and when she says something about menstruation, you're already like, nah, that's female, so I feel like give them safe space for them to talk about what is going on, and also advise them to seek medical help, because it's available for us and it favors women. So we should take that chance. Yes.
Let me talk to you as a girl or as a woman, not
Yes.
as a doctor.
Okay.
Can you share with those kind of menstruation history with your partner?
Yes.
Sure.
Yes.
Easily or
Easily. Easily. You know, because for me as a woman, I believe that whatever happens to me, I'm not the first woman and I'm not the last.
Okay.
So whatever is happening to me is not a miracle.
Okay.
It's not something that's not supposed to be, you know. It's supposed to be, it's natural. And I believe my partner has gone to school enough to learn about, you know, menstruation.
Yes.
So this is something that I openly share.
Okay.
If I'm in like those pains, I share, and he should know that, you know, my girlfriend during this time, she's in these pains, and if it's irregular, then what am I helping? Because sometimes we may not be able to help ourselves even if we know what to do. And the other person who's subconsciously, who is not in pain, who's not in the suffering, they may help you and they may be able to guide you actually.
Yes.
Yeah.
Thank you, Dr. Lee. This is a good topic. I think everyone who is watching us, he's going to know everything more about irregular menstruation. So can you tell us a key summary, 3 lines for someone to retain in all this conversation?
The key summary is we have regular periods. They are between 25 days to 35 days.
Yes.
So if it is less or more than that, then it is irregular.
Okay.
The second thing is we have lifestyle modifications that can help us control the irregularities. We talked about exercises, dietary, and stress management, meditation. And the other thing I could really stress about is seeking medical care, because it is available for you.
Okay. Thank you, Dr. Lee. Thank you, everyone who is watching us. And I say that irregular menses, it is normal. You are not the first and you are not the last. So don't be shy. Just go to the nearest health facility. They're going to help you. If you have anything, just change your lifestyle. Sleep easily. Sleep a whole like 8 hours, as Dr. Lee said. Eat healthy, drink plenty of water, and do sport. That are going to help you. So if you like our discussion, just go down there. You just subscribe. Anything you have a question, you write in the comment, and also you share to your loved one. So we love you. Ciao, ciao.
Ciao.